All right, so today we're going to talk about something that is so important. People can save lives with the information in this presentation. You can save lives. You can save lives. First, we're going to talk about pneumonia. Community-acquired pneumonia is the leading cause of death among residents in nursing homes. William Osler, a 19th century physician from Canada who founded Johns Hopkins Hospital, called it the captain of the men of death. Every year, pneumonia is the cause of 4 million deaths. Pneumonia has up to a 55% mortality rate among nursing home residents who contract pneumonia. One type of pneumonia is aspiration pneumonia. Aspiration is when food or liquid goes down into the lungs, and patients who are aspirating have a swallowing disorder, also known as dysphagia. That's treated by a speech-language pathologist. Aspiration pneumonia happens when bacteria travels with the food, liquid, or saliva into the lungs and starts an infection. Now, the prevention of aspiration pneumonia has to be managed by 3 groups of people. The dysphagia, swallowing disorder, has to be managed by the speech-language pathologist. The oral hygiene has to be managed on a daily basis, so CNAs will take care of that, and they'll be trained by a hygienist, and other oral care needs will be taken care of by a dentist. Doctors and nurses manage medications that have an effect on oral care, managing dry mouth, and also there are some medications that can be used to treat aspiration pneumonia once it's already there, like antibiotics. Let's talk about a study in Japanese nursing homes. And it divided people into 2 groups, an oral care group and a non-oral care group. In the non-oral care group, more people contracted pneumonia, and 80% of those who got pneumonia died from it. In the oral care group, fewer people contracted pneumonia, and more than twice as many people lived. So, if you think about it, both groups received medical treatment. They both had antibiotics for their pneumonia. But more than double the number of patients survived in the oral care group. An analysis of the mortality afterwards showed that oral care was a more effective treatment than the medical treatments. That means that the people who perform the oral care on a daily basis can have more power to heal these patients and to prevent them from getting sick than the doctors and nurses. Now I'll introduce Debbi Viger, who will teach us how to do oral care.
Hi, thank you so much for having me here. So now that you understand exactly how important it is, what we want to do is learn how to clean the mouth while controlling any fluids from getting into the back of the throat or causing any swallow issues. So, what I like to do is get everything set up before I begin. So I've kind of brought several things for you. First, whenever we're working in the mouth, we are going to put gloves on, obviously. I know that you're currently using the toothets, the swabs that we use. I personally am not a huge fan of these. These are great at removing food debris, or they can be used to moisten the mouth. If you dip it into a cup with mouthwash or chlorhexidine or some kind of medication, these can be used. But they're not really effective in removing the bacteria from the teeth. So for me, I much prefer a soft toothbrush. We know the soft toothbrush is able to remove the bacteria. With brushing, we want to pick any style, I don't care what color, what kind of brush that we're using, but the bristles must be soft. This is the most important part. So we're going to use the soft brush to break up the bacterial colonies. Now it takes 24 hours for the bacteria to grow, so that's how we came up with the brushing morning and night. In this particular setting, we really want to do it about 4 times a day just to make sure that we're really keeping an eye on the mouth, keeping the bacteria levels low, checking to see how the swallow is going and see if there's any irritation in the tissue. So, soft toothbrush. What I do is I start out using some form of lubricant on the lips. Some of your clients that you're going to be working with are going to be super dry. Others might have an excess of saliva. So keeping the lips well lubricated is nice. So I like to put a towel or something underneath their chin when I'm working with them, just because you are going to be using different waters. We want to keep everybody really neat. If you have someone that you think might actually bite down, I use a mouth prop. I find these are great just because it keeps you all safe and then everybody knows that it's not going to be an issue with biting. Some of your clients are going to be able to turn closer to you. You can either turn the whole body to the side that you're going to be working on or just turn their head. Some people you're not going to have that flexibility. So I do try to raise the head of the bed just a little bit so their head is forward so it's easier for you to see. So then I'm going to drape them with the cloth. I'm going to have my gloves on. I'm going to use a soft brush. And then you can use a disposable mirror if you want to have a better view of what's going on in the tissues in the mouth. But it's the actual brushing itself that becomes the most important. I dry brush when I'm in a client situation where they cannot swallow. So I'll either dip the toothbrush in a little bit of mouthwash or chlorhexidine or something to lubricate it, but then I'm going to use the towel to dry it off. I don't want to be adding any form of liquid to a mouth where I know that we've got a swallow issue. It's just too dangerous to take that chance. And I use what's called the Boit method for brushing. It's B-O-I-T, it's bumpy, outer, inner, and then tongue. So we're going to have our client opened and we're going to brush the biting surfaces, the bumpy parts first. I always start brushing in the upper right. Everything I do is a complete circle. So I'm going to do all the way around the mouth on the bumpy surfaces, then all the way around the mouth on the outsides, then all the way around the mouth on the insides, and then I'm going to brush the tongue. That way I'm following the same pattern every time. So if I stop for some reason, I always know where I'm coming back to. Your clients also become used to this. So they know about how far into it you are or what's going on, and it just is something that's easily reproducible. So I take my soft bristled brush, and I'm going to do back and forth on the biting surfaces, the bumpy parts. If you have someone who can swallow somewhat, or if you want, you can use a tiny smear of toothpaste, anything that's ADA approved, Crest, Colgate, AIM, Aquafresh. Stick with the big brands and look for that little ADA seal, or you can apply a little bit of mouthwash, but just make sure it's a small amount, just enough so that you're adding some fluoride to the biting surfaces. It'll help cut down on the amount of decay that we're looking at, as well as it can be antibacterial. So I've done all the biting surfaces. Then I'm going to tip my toothbrush up into the gum line, and I make little circles. But again, I'm starting in the upper right, and I'm very slowly and methodically working all the way around. Most of the clients that I work on, I'm going to keep them closed for when I'm doing the outside. There's no reason to stress the jaw. So all the way around. And again, starting in the upper right and working all the way back to the lower right. So I've done the bumpy, I've done the outsides, now I'm going to do the insides. This is when you need to have them open. So if you're going to be using that mouth prop, this is when you would just slide it in up against the cheek, and most of them have ridges in them, so you just put it between the teeth and they can bite real softly into the mouth prop. They're like 50 cents each. They're disposable. I use the same one for about 3 months. So as long as you label it and you store it appropriately, these can last a long time. But then I angle the toothbrush up into the gums and I go towards the gum in the upper right and all the way around. When you get to the front, the toothbrush really doesn't fit well, so I go straight up and down. Now while you're doing this, you want to keep an eye on the back of the throat to make sure that you're not building saliva, or if you have chosen to use toothpaste, that you're not building up anything in the back of the throat. If you are, you can take the towel that you've placed on the chin and you can dab with this, or if you are using the Tooth-X, you can use that to remove the excess fluid. Okay, so then you go straight up and down and all the way around. So this is your third and final circle. And then before I finish, I usually dry the toothbrush off, and then I'm going to brush over the tongue. Also, in these kind of clients, you can use the toothbrush to wipe the cheeks anywhere that you can see that bacteria could build up. So cover the whole oral surface. Okay? Then I use my cloth, and I'm just going to go ahead and wipe the mouth to make sure there's no excess toothpaste or whatever liquids might be in there, even if it's just saliva. I like to dry everything off. And when I'm totally through, I apply more of the lubricoat or some sort of lubricant on the lips. To fully brush a mouth takes about 2 minutes. It feels like an eternity sometimes. You do get used to it, but if you're making those 3 complete circles and then you're doing the tongue and the cheeks, it gives you an excellent visual. You will have seen every single thing that's happening in the mouth. So if you notice an area that's red or inflamed, or if it's bleeding at all, you want to make notes about that so we can get the client in for an exam. Okay. Some other kinds of rinses. They have just a lot of different things on the market. The spray is nice if you've got someone who's really dry, or Biotine. There's all different medications or rinses that we can use for somebody who might have a really dry mouth. Dry mouth is often caused by the medications that our clients might be on. And the problem with it is it's sticky, so it's hard for them to manipulate their mouth, or if they were speaking or something, that becomes a real difficulty. But it harbors more bacteria, and it's actually really uncomfortable. So their tongue gets really dry, and we want to do something to keep them pretty well lubricated. You can also use xylitol-based gels, but again, we want to be careful to make sure that we're not adding a lot of substances to the mouth that might make them salivate or cause any kind of excess moisture in the back of the throat because of all the inflammation and the problems with the pneumonia. Sometimes you'll find a client who has an excess of saliva. If it's possible, you kind of want to keep their head turned to one side, and then you can either use these kind of very attractive bowls, or you can just keep a towel on their side. So if you have someone who's actively, like seriously drooling, you can use any of the lubricants for the lips all the way through here in this whole area. Otherwise, their lips become really cracked and dry, and their skin can be irritated. Aquaphor is an excellent product that can be used. There's all different kinds. Lubricoat makes one, but something so that the saliva is not actively on their tissue, because it will begin to break down and become irritated. If you want to clean out in between their teeth, I almost never floss anybody anymore, especially people that are medically compromised. So I use Floss Picks. This particular brand is gum Floss Pick. They also make some that are biodegradable, which is really kind of cool. But these are nice because your client can have their mouth closed, and you just take the pick and insert it in between the teeth and just go back and forth. But if there's bacteria in between the teeth, these are excellent for removing it. And because they don't have to be opened, you don't have to worry about getting bit or being in there too long or their jaw getting tired. Okay? And this takes about 20 seconds to go through the whole mouth, so that's really nice. And again, start in the upper right and make that complete circle so you know where you started and where you finished. So with your client who has dementia or any kind of hand scale issue, I use this kind of brush for anyone who's had any kind of hand surgery. Sometimes shoulder surgeries will become an issue with the grip on the toothbrush. As long as the bristles themselves are soft, I'm okay with it. This one's nice because you know that it can't go too far into the mouth. They actually hit on the bumps, their front teeth, before it would go too far down the throat. But again, you want to look for whatever's comfortable. You can make this on your own with a tennis ball on a regular toothbrush, or a racket ball, any kind of ball. You just poke a hole in one end and then shove the toothbrush through it. So you can find all sorts of cheap ways to make toothbrushes. But with the brush, the only part that is super important is making sure the bristles are soft. And these brushes are great. I know a lot of people use these hospital-based brushes. These are actually disposable, but if you feel the bristles, they're pretty hard. So you really want to make sure that you're using something soft, especially patients that are medically compromised, because this can actually damage the tissue, and then you can end up with a bacterial infection. So you don't want to do anything that's going to cause more of an issue. So stick with the soft bristled brush and any kind of handle that works for you. I do find with my clients that have dementia that a lot of times they prefer to go away from the mint. It becomes a really strong, overwhelming flavor. And then I go more towards the ADA approved, the kid flavors, the grape flavor, the cherry. I'm really into the sugarless bubblegum right now and strawberry banana. But you want to look for something that makes brushing as pleasing as possible. You don't want to ever do anything that's going to cause a refusal or a bad feeling. You don't want something negative about something that's so important. So that's why doing brushing series like the Boit, where it's reproducible, you're making the same 3 circles each time, and keeping flavors that make it fun and make it light are perfect. If you do have a client though that truly does not care for paste, it's the mechanical action of the soft toothbrush that removes the bacteria that's so important. So if they really don't like paste, don't use it. It's just not worth, you know, the bad feelings that you might encourage or engage because of it. So just brush with that soft brush. That's the important part, is removing the bacteria.
How about when someone's unconscious?
Completely unconscious, I do the same thing. I want to try and tip their head to the right or whichever side I'm going to be brushing on. Use the towel on them and do that Boit method with the soft brush. But everything with an unconscious patient is, again, about making sure that we don't cause a situation where they have fluid buildup in the back of the throat. So as I'm brushing, I'm always watching. And the best part for me about using the washcloth is if I do notice that I'm starting to build up some liquid, these are so absorbent. I can just put it on the cheek side in their mouth, and then all the fluid's going to drain onto this. I can remove it and not have to worry. I think this is easier to use than like that toothette, which will absorb some, but this is going to absorb a lot more, and totally washable and keeps expenses down. So for me that works well, better for the environment. But it's the same kind of brushing format. So always do the biting surface first, the bumpies, the outsides, the insides, and then the tongue.
Thank you very much, Debbie, for coming over and doing this presentation. And let's raise the standard of oral care here at the Claremont, and whoever sees this video, join us in raising the standard of oral care everywhere. Thank you.
Thank you.